Hello radiographers, hope you are doing good. So let's do a CT scan of PNS technique and filming. So at first register the patient, put the patient name, patient ID and then sex, male or female, and then age of the patient. So for PNS, position the patient as like CT scan of head positioning, and from this select head first supine and then select the sinus and then OK. Click the load button and scanner will load for topogram, and a notification will appear in the red box. Press start and then press the start button on the control box, and a lateral topogram will appear. And now change the scan field of view, drag the line over the vertex and below at the base of the skull, include the maxillary sinus and obviously the frontal sinus. You can also adjust the reconstruction field of view and then click load and then press move button and then press start. And now the scan will start and scanner will give you some primary images, and you can see that the reconstruction is started automatically, and I have to cancel the post contrast protocols. The second reconstruction is going on. It's a cerebral window. And now it's the third reconstruction is going on, and it's the on the sinus window, and the kernel is H60, and the reconstructions are in 2 mm slice thickness. I'm checking out the images. So my reconstruction is completed. I will close the patient from the exam card. Now it's time to reconstruct the image, make axial coronal and sagittal images in the sinus window. So from the browser select the sinus 0.75 mm and select 3D, and in the 3D tab drag the reference lines and angle the orientation line so that the images are parallel in both sides, and all the sinuses, especially the maxillary sinuses on the both sides, are shown in same line or same anatomy. So let's first make the axial images. For this I have select the sagittal. On the sagittal images I am giving the slice axial slices and drag the slices so that the maxillary sinus included below to the from the teeth and to up to the frontal sinus, above the frontal sinus. I will make 29 slice here, and the image thickness will be 2, and click start button, and my axial images have been created, and I'm send it to the filming. Now I'm in filming, so I will change the layout to 30 because there is 29 images, and I have to put one reference image in the first box or in the first segment of the film. Then zoom the image so that only the sinuses appears, and zoom in the axial images to enlarge the sinuses and to show the sinuses clearly, you can see I make the slices from the tooth to the upper part of the frontal sinus, and the patient have maxillary sinusitis in both sides. You can see there is hypotenuse areas inside the maxillary sinuses. So I make this axial 2 millimeter sinus films like this. And drag the image so that the nose is not cut out. The front of the nose should be included in the image. And after completing, print out the film. Now again go to 3D tab and make another image, and right now I will make coronal images for sinus, and for this I will again plan on the sagittal image, but this time coronal plans. For this I am taking 29 slices and drag the first front slice at the upper part of the nose, and the last slice I will drag to behind the ethmoid sinus. Sorry, I will drag the last slice to the behind the sphenoid sinus. And now I am in the filming, making the coronal images. I select 5:6 layout. That means 30 images will fit in the film. And also add the reference image for the coronal images and zoom the image so that the sinuses are clearly visible. You should include the frontal sinus and to the lower part of the maxillary sinus, and at the back sphenoid sinus should be included. So after completing, print out this coronal images for sinus, and now let's make sagittal images. And for sagittal image I will plan on the axial image, and from the parallel ranges I will select the slices and change the slice orientation so that my number 1 slice will be in the right side and the last slice, that is 29 slice, will be on the left side. So drag the slice so that to cover the whole maxillary sinus from right to left, and click start and send it to the film, and also send the reference image. Now go to filming, and in the filming change the film layout to 5:6. That means 30 images will fit in the film, and put the reference image on the first segment, and then zoom the sagittal images. Adjust the reference image and zoom the sagittal image so that the sinuses is seen and make sure that the frontal sinus is not cut out. And also make sure that the maxillary sinuses from the right to left is included in the film, and also the sphenoid sinus at the back. So this is the sagittal reconstructed image for sinuses, and it's a sinus window, or you can say it a bone window. And now I will make a soft tissue images also, and this is a cerebral window image. So I will print out a cerebral window axial images. Now in 3D I will make the axial images for sinuses in the cerebral window. For this I will select image thickness 2 and 29 image, and planning on the sagittal image to make the axial images. And again I will drag the slices from the base of the skull so that the maxillary sinus included and to the frontal sinus above. And from the Prescient browser I take it to the viewing, and you can see that the head is oriented in the rightward. So I will rotate the image to leftward by 2 or 3 degrees so that the image is straight enough. And now I will change the layout to 5:6, and also drag a reference image at the front of the film. So adjust the reference image so that the sinuses are visible in enlarged view, and also zoom the cerebral window axial sinus images. So I will I am printing 4 films for sinuses, 3 in sinus window and 1 in cerebral window. Among 3 there is coronal, sagittal and axial films for sinus window, and 1 axial film for cerebral window. And after adjusting the film, print out. And thanks for watching. If you like this video, please hit the like button, and don't forget to subscribe my YouTube channel and stay with me. Thank you.